Tired of disappointing microsclerotherapy results? Or worried about making huge rookie mistakes? I'm here to share my years of expertise with 10 vital steps to microsclerotherapy success in the treatment of spider veins. Microsclerotherapy may seem straightforward, but experience reveals that there are subtle nuances that make the difference between good and exceptional results. So let me elevate your practice and address common concerns that patients have during treatment. These are the 10 step-by-step processes you should follow. Step number 1, thorough patient assessment and preparation. A meticulous patient history, an allergy check, and a thorough examination of your patient in the standing position are non-negotiable, even with seemingly simple cases. This safeguards your patient and your practice. Consent. Don't just explain the procedure, emphasize the potential side effects and set a realistic timeline. A signed consent form offers an additional protection, and consider making the signed consent form an essential and standard part of your practice. And here's a pro tip. Schedule the treatment on a separate day from the consultation to give your patients ample time to make an informed decision. Step 2, have a treatment day checklist. Being meticulously prepared for your patient boosts patient trust. Double check your supplies, check the expiry dates, and have a written checklist ready to avoid any oversights. Step 3, optimal patient positioning. Comfort is crucial for your patient, so make sure you take great care to ensure that your patient is comfortable and that they're adequately supported. The areas that you should support particularly are the neck, the back, the knees, the hips. And you need to be particularly careful with patients who might have mobility issues. This facilitates accurate injections. So here's another pro tip. Have some extra pillows in your clinic so that you can support those areas that I've just mentioned. Your patient may have to stay still for quite some time because you may need to concentrate and inject large areas. So you need to keep your patient comfortable. Step 4, vein mapping. Don't rush vein identification. If you miss veins, then you'll have a disgruntled patient and you'll have poor results. Use good lighting and magnification as standard practice. Mark your veins carefully before you start treatment, and in this respect, make sure you ask your patient to point out the veins that they are particularly concerned about. You don't want to let your patient leave and not have treated those areas that they were particularly concerned. That's a recipe for complaint. Step 5, identify feeder veins. Why? Well, if you don't inject the feeder veins, the spider veins will simply come back. So, the fix for this is to make sure that you've got some way of identifying those feeder veins. Some people can see them very well in good lighting, others need help. And if you need help, a good visualization device is the VeinLight transillumination device. Step 6, before you actually go to pick up the syringe, make sure you wash your hands. Meticulous hand hygiene is essential. If your patients see you meticulously washing your hands and paying particular attention to hand hygiene, if they see you putting on gloves and an apron before you start treatment, this instills a lot of confidence in your patients, and it will boost the complete air of professionalism in your service. The last step, step 7, is of course precise injection technique. In this respect, a gentle technique is vital. As I always say, adopt the low, slow, low approach and ask your patient if at any point during the procedure they have any pain or discomfort. Microsclerotherapy should not be painful. The needles are very fine, 30 gauge, and the sclerosant should be mild, and if it's injected directly into the spider vein, there shouldn't be any pain. If the patients complain of pain, something's wrong, you need to stop. So inject low volumes of sclerosant slowly and use the lowest concentration of sclerosant possibly. Step 8. When you come to remove the needle after your injection site. When you come to remove the needle at the injection site, I would apply some compression with a cotton wool ball and gently massage the area to disperse the sclerosant. This has two effects. Firstly, it will, as I say, disperse the sclerosant evenly around the injection site, but it will also provide some mechanical disintegration of the endothelium and perhaps improve the results. In my microsclerotherapy courses, I refer to this as mechanico-chemical endothelial destruction. Step 9. Give your patient clear post-procedure instructions. Manage expectations. Provide detailed and written instructions so that they know that the veins are going to look worse initially, and give them contact information. How would they contact you if they had any concerns after the procedure? Telephone, WhatsApp, texts. Make sure they can contact you. Final step, step 10. Make sure that you have follow-up arrangements in place. Before they leave, document the procedure and make sure that they have an appointment to be reviewed. This is an opportunity for you to provide reassurance, particularly if they're looking worse. It's an opportunity for you to identify any retained coagulum that needs releasing by microthrombectomy. And it's an opportunity for you to communicate with your patients and for them to communicate with you. Do they have any concerns? Are they worried? And it's also a good time to take photographs. Documenting everything and arranging appropriate follow-up is good for medical legal reasons, and it will also prevent complaint. Make sure you document the amount of sclerosant used, the concentration, the batch number, and any adverse incidents that might have occurred during the procedure. Was there a bleb formation? Was the patient in discomfort or pain? All of this protects you from medical legal or complaint issues, and it also helps you document the progress of your patient. And it's also a good way for you to audit your results. At the follow-up appointment, patients are often concerned because their veins actually look worse. And it's a good opportunity for you to reassure them and empathise and allay any concerns. Mastering microsclerotherapy takes more than just knowing how to inject. Click the link in the description for my free mini course, How to Inject Leg Spider Veins and Blue Veins, in which I share pro tips. I provide you with a free video, a mini manual, and a microsclerotherapy cheat sheet. I also provide you with additional strategies to get great results. If you're committed to providing the very best possible results in microsclerotherapy, give this video a thumbs up and share it with your colleagues. And don't forget to subscribe to my email newsletter, where I share with you more vein tips, and I also share with you business fundamentals for a successful private practice and clinic.